Most respected Dharmaraj Rasalam Tirumeni in his absence, Dr. Bennett, Director, CSI Medical College, Principal Professor Sampson, Office Bearers of the South India Diocese, all the faculty of this esteemed medical school, and my dear students. Let me introduce myself. I am Professor Matthew Thomas, Professor of Medicine and Hematology, working as a senior consultant in the Department of Medicine in KIMS Hospital, Trivandrum, and as Professor of Medicine in CSI Hospital, Karakoram. I have been teaching medical students for the past about 50 years from 1972. At that time, when I started teaching, I was a postgraduate student in medicine in Medical College, Trivandrum. I retired from the Trivandrum Medical College in the year 2004. In 2003, the Kerala government awarded me the Best Doctor Award in the state. After 2004, I am working in the KIMS Hospital, Trivandrum, and CSI Medical College till now. I should congratulate all of you for getting an admission in this prestigious medical school this year. You're joining the medical school during a very strange situation of the COVID-19 pandemic. This pandemic is with us for the past 1 year, and we do not really know where we are heading to regarding the serious and unpredictable disease which is baffling many doctors and scientists around the whole world. This is probably the first time in the history of medical education when the newly joining medical students are quite uncertain of many things, including their regular classes, their exams, and a reduced hospital activity, that is, patients attending the hospital for other diseases are considerably reduced now throughout the world. Let us, for the time being, put aside all these obstacles and remember that you have decided to join one of the most noble professions of the whole world, that is, the medical profession, to help, love, and take care of people who have been stricken with various diseases. Decide in your mind that you will go on, whatever be the situation. This profession was practiced for the past many centuries, and this has improved the health of the inhabitants of this planet. The average life expectancy, even in a developing country like India, has increased from 40 to 50 years at the time of independence to about more than 70 years now. It will be now your turn to sustain or improve this statistical figure by your work as a doctor after completing your studies. Medical education has undergone a series of changes in the past few decades, but the basic pattern remains the same. We need doctors to diagnose and treat diseases. We need doctors to teach medical students and mold them into good doctors. We need doctors to do research and bring about many new changes in diagnosis and treatment. We need doctors to excel in administration so that the whole medical fraternity can move forwards and in all the fields. And we also need doctors in many other fields. During your undergraduate studies, you can plan what you want to become so that you can be ready after your basic studies. Although medical education has changed into many new forms and attire, the basic trend remains the same. First, the medical student should have a zeal, interest, and an intent to study the different subjects in the medical curriculum, whatever it may be. The subjects may be anatomy and physiology, which deals with the normal structure and functioning of the human body, or it may be clinical subjects like medicine and pediatrics, in which you learn to diagnose and treat diseases occurring in different age groups. The selection of the method of study can be decided by the medical student according to his or her previous experience and inherent nature. You can study alone, or some others like to have a combined study. Anything is okay. Any method is okay provided time is not wasted. Medical educators are trying to incorporate novel integrated methods in medical education in different parts of the world. For example, even in the first few days of joining the medical school, you may be taken to a medical ward of the hospital and you will be shown a real patient having a cardiac failure. Mind you, in the initial days of your entrance to medical studies. The same afternoon, you go back or come back to your college and learn the anatomy and physiology of the heart along with the biochemical changes of myocardial infarction. In this way, you will be able to integrate the basic knowledge of anatomy, physiology, and biochemistry with pathological and clinical abnormalities. You will reap the benefits of this and many other new changes if you are sincere, persistent, and intense in your studies. Here comes another advice, very important advice. As far as possible, do not miss any classes, whatever the subject be. There is a wrong thinking prevailing among the medical students these days. Many students may develop a thought, why should we go to these classes? We can learn all these things from the internet. But I tell you, this is a very wrong direction. The description and explanation by an experienced teacher are sometimes something very unique. You can never get it from the internet. Just imagine the medical student missing the morning session of the cardiac failure patient and attending only the afternoon session. I advise you to set apart at least 3 hours of study every day. You could do this by staying longer in the night or by getting up early in the morning. Do not mix it up. Have the same time. Try to study what is taken during the day. Anatomy, physiology, and biochemistry side by side. It will take some time for you to settle down in your studies because it is quite different from how you learned and studied in the 12th class. You may require more time to understand a small quantum of knowledge, but do not give up. There might be many things to memorize as in anatomy. Do it many times. Prepare well for your class exams, which are very important, and try to score very good marks from the beginning in these class exams and keep it up. I think that a combined study with someone better than you will be highly rewarding. Try to learn something extra than what is taught in the class. For example, chest pain is a very common symptom in many patients in the wards. When you learn your anatomy, try to figure out the anatomical structures from which the chest pain can arise. Example, the myocardium, the pleura, the ribs, the cartilage, nerves, muscles, and the big vessels like aorta. Chest pain can arise from any of this. And you also learn how the mechanism of pain in each of these conditions. And this extra work will help you to prepare yourself for a future clinical case of chest pain. If you are systematic and sincere in your studies, like 2 to 3 hours a day, from the first day onwards, you will smoothly sail through all the subjects. Remember that you are not to study all the 24 hours a day. You should have extracurricular activities like music, singing, painting, games, poetry, etc. I still remember joining the music club of Trivandrum Medical College after joining the first year of my medical studies and playing guitar for the Ghana Medal. These extracurricular activities help you to think and act differently in a broader sense rather than with a narrow mind. Another big advice, make friends with as many as possible, especially your classmates who are going to be with you for a long time, many years. Build up good and deep friendships so that you can render help to others and receive help when you need it. Respect and love your teachers, senior students, junior students, and all the other staffs of the hostels and hospital. Try to have a good student-teacher relationship, a character which is fading away in the recent times. When you finish your basic studies in the first year, you enter another big life, the hospital life, the world of patients of different types. You will have to develop very important virtues like the art of communication and the art of documentation, which will stay with you even after all your studies. And when you are practicing, talk to your patients and their relations as much as possible, discussing even non-medical subjects like welfare of the patient's children, their work, etc., to build up a good rapport. Documentation. Document clearly when you take the history and examine a patient in the ward. Love your patients and be sincere towards them. Try to talk to them and continue the rapport even after they are discharged from the hospital. Consider the patients as one of your close relatives. We have seen medical students going astray by getting addicted to alcohol, smoking, and even drugs. Please stay away from all these dangers and save your valuable lives. They will destroy you and your family, so you will stop being like a human being. Remember that medical students and doctors are not immune to medical illnesses. Anyone can fall sick anytime. Don't delay medical help and consultation whenever you are sick. If you get a chance to take the vaccination against COVID, do not miss that chance. Take 2 doses at the correct interval. I wish you all the very best in everything, including your hard and tough medical studies in the years to come. May the Almighty God bless and help you in your endeavor, without which I believe we will not do well. Please remember and put into practice what I have advised very sincerely and with a long experience behind me. Thank you for the patient hearing.